Good afternoon, everyone. I'm Governor John Carney here for the first of our twice-a-week press conferences on our state of Delaware's response to COVID-19. I'm joined again by Dr. Darrell Carroll, who is the Director of the Division of Public Health, and A.J. Shaw, who's the Director of the Delaware Emergency Management Agency. I want to thank all the press outlets for being here and those that have submitted questions in advance. We have a presentation, kind of normal presentation in terms of the deck that we have today to walk through, and then we'll open it up to questions. I come to you today really pretty excited and pleased with what I saw over the Labor Day or the Memorial Day weekend as I traveled down to Rehoboth to see firsthand the situation on the ground on the boardwalk and beach in Rehoboth and then in Lewis and at Cape Henlopen State Park, Fort Miles. It was Memorial Day, and so a solemn day for Delawareans, particularly those who had family members who made the ultimate sacrifice in wars and conflicts in past history, but also a somber day as we remember those who succumbed to COVID-19 over the last 3 months. But it was a day to feel good about the progress that we've made in Delaware. I've been looking forward towards the weekend that's passed for some time now to determine whether we could get through a reopening at our beach communities in a way that was safe and didn't risk public health, and I thought that's what I saw. And we'll see some slides later that kind of compared the situation on the ground to here in Delaware, at the beaches in Delaware, to the beaches in other places in the region and across the country. And they've been on television, folks have seen those, and I only point out that contrast to express gratitude to the people of Delaware and others who came to Delaware with the 14-day quarantine to enjoy our beaches and of the seashore there, but did it in a way that was responsible and reflected an awareness of neighbors and everyone around you. And as a result, I feel really comfortable today about the decisions that we're announcing on today that I mentioned late last week about opening further the beaches here in Delaware and other venues, and we'll talk about that as we go through the deck. But I think it's appropriate to thank all Delawareans for pitching in. Everybody made sacrifices. Some made bigger sacrifices than others as their business was dependent on crowds and gatherings. Frankly, the hospitality industry, tourism industry really has been battered pretty significantly, and we've been working with that sector and will continue to do so to help them get back on their feet and survive and be what they are to our communities, just in addition to our quality of life that's almost like no other, in combination with our natural heritage and the beauty of the outdoors here in Delaware. And I think it is a good indication that Delawareans do think of themselves as a state of neighbors and treat one another as their neighbor, and are conscious of the fact that their actions affect their neighbor, and particularly those who are vulnerable citizens, the elderly, who comprise the vast majority of those who've succumbed to COVID-19 in our state. And I just want to express gratitude to all those folks, to our healthcare providers. Again, we can't say it enough, to the hospitals who've treated the patients, the more seriously ill, critically ill, to our first responders, frontline healthcare workers, to the poultry workers that were required to go to work during this very difficult and stressful time, particularly as COVID-19 was present in their plants and in the communities. And we think if there's a notable effort, that's it, the way we came together as partners with hospitals, local healthcare providers, community healthcare providers like Lared, Westside Health, and all the folks that pitched in to reach out and test thousands of poultry workers in Sussex County, thousands of people who live in those communities, and really enabled us to get ahead of it and I think make us more comfortable as we move to the next step. So let's go through the numbers. We're up to 9,000 positive cases. We continue to get positive cases, obviously. We're testing at a rate, AJ, I think that's twice what it was before on a week-to-week basis. And even though the percent positive is down, which is really a good sign, the cases still mount up. We're sadly up to 335 total deaths, 4,800 that have recovered, and it's important to point out that some people who recover, we don't hear from them, and so they don't get included in this number. But if you do the math and you subtract those that recovered from the positive cases, you've seen that we've kind of leveled out at about 4,000 to 4,500 or something like that. I'm not sure that's an indicator to look at, but I certainly look at it on a day-to-day basis. And we're down almost to 200 in current hospitalizations, which is, as I've said week in and week out, the most reliable number that we have, because they're actual people that are counted in hospitals in critical care in whatever condition. 3,500 of the positive cases in Newcastle County, almost 1,400 of positive cases in Kent County. Sussex County still leading with 4,100, again, probably twice as many plus as a percentage of the population of testing that was done down there because of the outbreak in the poultry industry. Again, a breakdown by age, nothing really significantly that has changed there. And then our data dashboard, you can see that all the main indicators, the hospitalization rates in particular, which are the first two graphs at the top, and then the one on the top left corner, you can see it consistently moving down, and even the Sussex County component of that going down, notwithstanding the number of positive cases going up, which I know is a question that many have, including myself, and we can think about that as we move forward. I happen to believe that it in part has to be the demographics of that population in terms of how old they are, and because most of the fatalities, as we know now, are in the elderly age group and people with compromised health conditions. Again, the percentage of persons who test positive on the far right there is trending down as well. It does go up and down, but one time when we first started testing in Sussex County at the poultry plants, we had infection rates, closing in on 30% or more, and the testing rates that I see and the testing that we're doing down there is around 10 to 15% and even lower in some cases.
It's not lower right now.
Yeah, so all good. And you can see in the middle of the bottom line, that's the percentage of emergency department visits for flu-like symptoms and COVID-19-like illnesses by week. And you see that's kind of the nicest graph that the public health folks talk about all the time in terms of peaking and then reducing as time goes by. And of course, cumulative cases will continue to climb, but hopefully flatten out. The glass is all full with respect to PPE, and we're happy about that. This is something we'll continue to look at. It's a requirement for moving to phase one. And so with all of that, we thank all the Delawareans for wearing face masks, for social distancing and staying home. As I was on the boardwalk yesterday at Rehoboth Beach, it's required to wear face masks on the boardwalk. I would say 80–85% or more of the folks on the boardwalk were wearing face masks. Contrast just to a couple weeks ago when that was not the case, and understandably it goes up and down, I think, but the signage was there. This is one of the signs that we've put up on the beaches in conjunction with Rehoboth Beach town. And Mayor Coons and his team really deserve a shout out and credit for what they've done on signage, partnership with us. I spoke with the captain of the beach patrol and some of his guys that were there with him on the boardwalk, and they were all wearing masks and showing the right way by example, and they had the right attitude towards folks that weren't wearing masks or keeping separate. They had ambassadors on the beach. I did not see any yesterday, but doing that same kind of messaging, educating first over enforcement. And so this is essentially what I saw. This is a drone shot, I think, from Saturday, I want to say. So a little different than what I saw on yesterday, which was a little more crowded than this. And this is the way we like to see the spacing on the beach and on boardwalk. Obviously, if there are more crowds, there are going to be more folks in both venues, and that's the challenge. I think for each of the beach communities, I was on the conference call with the mayors this morning, and again, great partners in thinking through how to do this and how to accomplish it in Lewis and Rehoboth Beach and Dobie Beach and Fenwick Island, Bethany Beach, South Bethany, Delaware Seashore State Park. Very different venues and with different abilities to control crowds. The next slide is just a shot of Ocean City, which is very different. If I had seen this yesterday on the boardwalk in Rehoboth, we would have been having a really hard discussion today, I think. But we didn't, and I think that's an indicator of Delawareans really leaning in and understanding that we are a state of neighbors and that it matters. And this, if you could go back to that looks more like what we saw, not so much on the boardwalk, but on the beaches on the weekend before St. Patrick's Day, and really forced us to take stronger action to keep people separate. And we're going to have to continue to do the social distancing that's required. We've got great signage out there, and I have a level of confidence now that we can start moving and rolling forward into June 1st and beyond. And so again, as of June 1st, we will lift the short-term rental ban and the mandatory 14-day quarantine for out-of-state travelers. These are the two mechanisms that we were using to try to keep the crowds down. They have been in effect for a couple months now. I was out at the Lowe's near the Pennsylvania line and drove through the parking lot and counted 86 out-of-state license plates, and so we're not in some places getting a lot of voluntary compliance, and we did see crowds reduced at in the beach areas, but so we've decided to lift those as of June 1st and also lift Delaware's stay-at-home order effective June 1st. But we're not asking Delawareans to disregard wearing face masks or avoiding unnecessary large gatherings or taking unnecessary trips into public places. As Dr. Birx from the White House Task Force, explained it pretty simply just a couple of weeks ago, and I've mentioned it before. If we just cut in half, each of us, the number of trips that we take to the supermarket, the pharmacy, out in public as we would normally do, I mean, that has the kind of effect that you need to keep and prevent the spread of the virus. And so starting one, we're also allowing in fully unenclosed outdoor spaces, so fully outdoor spaces, gatherings up to 250 people will be permitted. And then gatherings more than 250 people would be not allowed at all locations and venues, parades, festivals, graduation ceremonies, unless there's an organizer of an event that would expect more than 250 people to apply to host a large outdoor event by submitting a plan to the Division of Small Business, just to make sure that we can put in place protections around really unsafe practices. So the basic guidance is that outdoor gatherings should only be carried out if there's a plan following the guidelines to protect vulnerable populations in particular, and other public health precautions, wearing face masks and social distancing, the ones that are most important. Graduation ceremonies, I know it's so sad when you think about it that students who've gone through and are reaching graduation and looked at the graduation events that were not the big events that we've grown to know and love. And so schools wishing to host a graduation ceremony with more than 250 must submit a plan to the Department of Education, and guidance will be issued later today for those kinds of ceremonies. So congratulations to the class of 2020. I know a lot of the college kids have had remote graduations on their front lawns. If you drive around town, you'll see signs on front lawns congratulating college graduates, and we hope to be able to congratulate our high school graduates as well, and do it safely. I also want to thank those who've, including my wife Tracy, who've been helping serve meals to children while they haven't been in school. Over 1 million meals served across the state of Delaware, and here's a collage of some of the thank you events to those. I see Mayor Przicki and my wife Tracy there at the bottom. Just thank you all for feeding our children in this very stressful and trying time. You know, as you think about what we've been through over the last 3 months, and we talk about the data, we talk about improving conditions, we talk about percent positive, we talk about hospitalizations, it really is kind of easy to forget that we've had so many people pass away. 335 Delawareans, almost 100,000 Americans were lost to COVID-19. Every one a precious soul with family members, with a history, and so many of them weren't able to get the final tributes and goodbyes from family members and friends through the funerals and viewings. The New York Times ran an article where they printed, 10,000 or so names on the front page, and they included these 6 Delawareans, each with a history, each with a biography, each with family members and friends, each with things that they love to do, each that need to be recognized in a special way. And yesterday, as I was watching some of the remote Memorial Day ceremonies, somebody pointed out that over the last 3 months, the 100,000 Americans who've passed away with COVID-19 is more than the American soldiers who were killed in Vietnam and in Korea combined. So in 3 months, 100,000 is more than those two conflicts combined. And on a Memorial Day where you're really in a solemn way celebrating that sacrifice, we also need to remember, as we move to the next phase, that there's been a tremendous toll that's been taken in lives across our country and here in Delaware. So the message there is, let's not allow all that sacrifice to go to waste now. Let's continue to follow the public health guidance. Let's continue to remember that we need to keep our neighbors safe, particularly our neighbors who are vulnerable and elderly. And if we do that, we'll get through this together. We're not out of this yet in terms of we don't have a vaccine or a treatment for COVID-19. We do know ways that we can prevent its spread. And if we follow that public health guidance, if we are thoughtful about our neighbors and the fact that we're all in this together, it's not every man and woman for him or herself that will be able to continue to improve and continue to to reopen our economy and get things back to a new normal. And so with that, I'm going to turn it over to Dr. Rattay, and she's going to move into and talk some more about some testing issues and some of that information, and then we'll move to AJ, who will talk more about the logistics of our testing efforts. Dr. Rattay.
Thank you, Governor. So when we rolled out our testing plan a few weeks ago, one of the categories that we said we wanted to expand upon was testing for employees. We know that some employees in particular, are more at risk to COVID-19 based on their exposure to individuals, members of the public, or specifically individuals with COVID-19. And we also know that individuals who are COVID positive as employees can put others at risk. And so we have identified categories of businesses where employers should consider testing, and that guidance is now available online at de.gov/coronavirus, located under Resources for Businesses. And so this guidance provides general guidance for businesses overall to help protect employees and customers and clients. But it also identifies categories of businesses that may have employees at higher risk for contracting COVID-19 based on their job duties. And these businesses are encouraged to set up testing plans for staff based on their employees' risk exposure. This information is based on CDC and OSHA guidance. We actually did not find the specific guidance from CDC or OSHA or other states who had pulled this together. So I'm not sure if any other states have done this yet, but we're using the best available science from CDC and OSHA and our experiences. And we're advising employers to coordinate with us, especially if they have any questions, concerns, want support in how to coordinate testing for their employees. So one thing that OSHA did was they categorized employee risk into 4 different categories: very high, medium, and lower risk. So those in the very high category are those individuals, specifically healthcare, laboratory, or mortuary personnel, who have a very high potential for exposure, meaning they are working with people with known COVID-19 and performing procedures that aerosolize particulate matter or aerosolized droplets. And so these are individuals who it's especially important that they are aware of their COVID-19 statuses. They are at very high risk of exposure. But also at high risk for exposure are other healthcare workers, first responders such as fire, police, EMS, those who work in laboratories, those who are medical transport workers, as well as others who provide mortuary services. They may not specifically be providing care for individuals with COVID-19, but they're providing care for individuals who may have COVID-19 unknowingly, and additionally, these are individuals who have close contact with individuals, often for more prolonged periods of time. The medium category are individuals who are exposed to individuals in the public. It may be for very brief encounters, or they may be less than 6 feet from individuals, but nonetheless, these are individuals who interact with members of the public, or individuals who work in more tightly quartered situations, like the poultry plant workers, where it is more difficult to social distance in the work site. So in the medium category, we consider things like people who provide social services or education, manufacturing, like meat plant industry, as well as others providing frontline services, those in high-volume retail or food establishments, correctional staff, cosmetology staff, as well as childcare workers. Now, I'll talk in a few minutes a little bit more about this, but there are some in the medium category that are at higher risk than others from our perspective. So like those who are in tight quarters for long periods of time, or like cosmetology staff who are in very close contact with individuals for prolonged periods of time. And at the lower risk is really the majority of workers who are office or industrial facility workers, or many people who are working at home right now who just don't really have frequent close contacts with either coworkers or customers or the public, and can more easily social distance. So employees can get tested in a variety of ways. There are a lot of different options out there. There is not a one-size-fits-all, and so we'll work with employees on figuring out what's the best approach for them. I mean, many employers have occupational health individuals who lead their occupational health, but also, we encourage testing through primary care providers. So that's a primary option for individuals, but also, of course, there's the hospital and other community testing sites that we're doing throughout the state. So those are options. But also employers can provide testing events on their own for employees. And this could especially be in partnership with private laboratories or health system partners. There are a number of partners in our state who would be willing to partner with employers. Additionally, we wanted to mention one option, which is LabCorp now provides a home test. So employers could ask their employees to just sign up to get this test sent to their home, and they could ship this back. And we know the technology and the options around testing continues to change, so we expect the options for employers to change as we go forward, but these are just some of the options available right now. General guidance for employers that we absolutely want to emphasize, and especially since now many people are going to be going back to work. So first and foremost, we want to continue to emphasize that if it is at all possible, unless anything significant has changed, people can continue to work at home at this time. That is the best option, but we know that's not a great option for everyone. So for those who are going to the workplace, it's important that they are monitored for symptoms daily. For many of us do direct monitoring, where we take a temperature and somebody's asking you about your symptoms when you enter, and that really is the best. Employers should be encouraging people to stay home when they are sick, and providing the support that they need to be able to do so. Employees should be able to, or must be able to, work socially distanced as possible, meaning 6 feet separate from everyone else. And additionally, employees should be wearing face coverings, especially if they're around anyone else. And this goes for both staff and customers. Additionally, staff should be regularly hand sanitizing or hand washing, and hand sanitizer should be available for customers as well. And additionally, and very important, frequently touched surfaces should be disinfected every 15 minutes to 2 hours. So let me shift gears a little bit. There's been a lot of attention on how we report antibody test results. So I do want to go into this in a little bit more detail today. So as we've talked about before, the antibody test results can give you a negative, or it can give you an IgM, which indicates there's a risk of current infection. Certainly it indicates exposure. An IgG is an indication of past infection, and sometimes you get an IgM and IgG together, so there's that does indicate that there's some risk of current viral shedding. So when a person's antibody result shows an IgM, which suggests that they have a risk of current viral shedding, that is considered in our positive case count. If they have an IgG only, that is not counted in our positive case count. When we report our cases to the Centers for Disease Control and Prevention, we report the combination of the PCR positive test as well as the IgM antibody test positives. And so when we report our cases on a daily basis to the public, currently we add those together. Now we are working to present the PCR or the confirmed cases and the probable cases separately as we're becoming increasingly aware that there is an interest in that. But what I can say is that our data do not support any speculation that our positive numbers are inflated. 90% of our numbers are confirmed or PCR positive. About 10% of our positive cases are in the probable definition, and most all of those are antibody tests, meaning that they have a positive IgM. And what we've talked about before is the test that we have used has a 99% specificity, meaning a positive test indicates that a person has been exposed to and has had the COVID-19 infection. So with that, I'm going to hand it back to the governor.
All right, thank you very much for that, Dr. Rattay. And one of the issues there is as we move forward, and we definitely are into a new phase, and AJ will talk about that with respect to testing, is how do we do the testing for particularly essential employees and employees that are exposed more often to members of the public. And we'll be talking about that, working with sector groups and working with individual businesses and folks like the University of Delaware and others, AJ, as we develop our plan.
No, absolutely. I think as we, continue our community testing, I think then we want to drill down into some other professions and sectors that also have a risk, and we want to help, what we could do to get the economy back on track as quickly as possible. So I think right now it's, we're a few weeks into really ramping up our community testing. So I have a graphic here, just kind of shows where we've been over the last 2 weeks and where we'll be through a week from today through June 2nd. Some of these points on the map here have had multiple testing sites over the last few weeks, but just a visual, we're using that, we are hitting all parts of the state. We'll come back with you guys this in a few weeks, and we'll even have more dots on there as we identify other areas to go through. But, have had some great partnerships, and it's not just the state. It continues to be our nonprofits, continues to be the hospitals across the state that make this all possible. To drill down a little bit more, for May 16th from Seaford, we had testing this in multiple testings in Dover. Last week we talked about the 2 in Newcastle County on the same day. Sunday of a holiday weekend, we were able to get 981 people to go through the Dover DMV to get tested. So again, almost maxed that event out, which was good news. Today we're in Wilmington at a few places. Thursday we'll be in Claymont again with Christiana. Harrington will be a drive-through event that the state's sponsoring, and then doing some first responder testing in Lewis. Again, then the Latin American Community Center in Wilmington, more places next week, Victory Christian Fellowship next Wednesday, and then Bridgeville the 4th. So it's going to be a road show really that we're moving around, but we know that the drive-throughs are only going to get certain people, and so we're still working with our community partners to make sure we could drive down to the those that might not have transportation or don't think they need to be tested, and really do a little bit more of an outreach at the community level. So if you look at the last 2 weeks versus the 2 weeks prior to that, we've doubled our testing on an average, and we're up to about 1,400 tests a day now compared to about 740 the first 2 weeks of May, or last week of April, first week of May. For the testing sites, you could go to coronavirus.delaware.gov/testing. It has a list of all our partner sites. We update that as we get confirmation of events that are coming in. We also know that on there is going to be the accessibility for people if they don't have a doctor and they want to call 211 or talk to people at public health. It has all that information you need. And again, this is a team effort. You know, our hospitals have been our lifeline to be able to get to this point. We are going to help them as much as possible, take some of that burn off them. And then, as the governor and Dr. Rattay were talking about, you know, the next step comes to drilling down in the community and employers and large employers to see what we could do to assist any way as possible. So, you know, a moving target, lots of success so far, and look to have more stories coming up with increased numbers of testing, which is good news for us. Lastly, the business to business toolkit. So we understand as businesses go to prepare to reopen in the next few days, with phase 1 starting a week from yesterday, and people looking at like the phases that come down, there is equipment that they will need. You know, face shields maybe for some of those people that work in close quarters with others. PPE, not the medical grade personal protective equipment, but maybe food grade gloves or cleaning supplies, hand sanitizer. The state has received, you know, information from hundreds of vendors, if not more, over the last several months, and we've collected that and we put it together in one portal that people could drop information in there and get direct access to people that the state has collected from. We haven't vetted everybody, but there are people in there that we have used before. We also could use this for businesses, go directly to business in the state of Delaware, where could partnerships be made to make sure we're helping each other out as we open back up. So kudos to everybody that's worked on this, from public health, from DTI, from the small business, from our nonprofits, from, you know, Office of Management and Budget. This was something that, again, we're just hoping it's one thing that will help give those businesses a little bit more information, a few more relationships to really help them open back up and open up safely in the next few weeks. So, Governor?
Yeah, so really good stuff there. The business-to-business toolkits parallels an effort that we're doing with respect to the kits that are being distributed at the community test sites to folks that live in vulnerable communities and communities that are stressed with COVID-19. I think it's, again, important to point out that we're moving into the new phase, a new phase of containing the virus. The virus hasn't gone away. It's a phase where we will replace the blunt instrument of stay-at-home orders and shelter in place and closing down businesses to one where we gradually reopen those business sectors in a way that's safe, that keeps people separate, and that enables the businesses to get revenue and to bring customers back. And customers aren't going to come back unless they feel safe and confident that they're not going to be exposed to the virus. And I know our business sector partners really understand that and appreciate that. But we're really going to be relying on testing, isolating those who test positive, contact tracing, identifying folks that have come in contact with that COVID-19 positive person, testing them, isolating positives, and on and on. And the contact tracing team is moving forward with the National Guard leading the way, and we'll be talking more about that, and I'm sure in the days and weeks ahead. So the Memorial Day weekend was a good weekend for us. Certainly it was a successful one, as we saw the activity on the beaches in Rehoboth and across the Delaware beaches with appropriate protection, social distancing on the beach and boardwalk, wearing of masks on the boardwalk and even some on the beaches, and crowds in a manageable way. We know that as crowds are invited back, as we eliminate the short-term rental ban and the 14-day quarantine, folks are going to be coming back from other states, that we need to be more vigilant really about the mask wearings. And I ought to also point out that I was really impressed with the retailers and small business folks that were all doing takeout business, as they normally do at Thrasher's French Fries and Grotto Pizza and the like, and Dolly's, but they had the plastic plexiglass shields protecting customers from cashiers, and They had the markings on the pavement. Just really impressed with what I saw. And so it indicated that folks understand that we're in this together, that we need to be smart, particularly now as we start to recirculate again. We need to continue to wash our hands and wear our face masks, practice social distancing, and to protect our neighbors. And so with that, I'll open it up to questions. Meredith, thanks for coming.
Hello. Governor, I know you said you were happy with what you saw this weekend at the beaches. I do think some people still saw pockets where people weren't social distancing and weren't wearing masks. And in looking ahead with the restrictions being lifted, how is the state going to prevent what happened in Ocean City or the Ozarks in terms of just people ignoring mask wearing and social distancing?
Yes, that's a really good question, and I think the answer is constant, positive educational reinforcement. I mean, I really think that works over a negative approach to enforcement, with the emphasis on enforcement and citation and the like, because people feel, to a certain extent, rightly so, a little bit put out by everything, right? And they feel like the government shouldn't tell them to do this or that or the other thing, even though everything that we've done has been with the objective of protecting their health and everyone else's. And that's lost often on folks. Folks think that they can do it on their own. And so it will take a delicate balance. It will be harder when the weather gets better. The weather was marginal certainly on Saturday, as I was in contact with Mayor Coons and Speaker Schwarzkopf, and I can't thank the Speaker enough for what he's done over the last several months in providing help and guidance, particularly in his area there in the beach communities, and all of them. I mean, the retailers really stepped up to the plate. But it is, I mean, and I think Mayor Coons and his team have what I saw, struck a nice balance. I think ambassadors is the way to go, right? It's inviting, and yet it's educational. And we're just going to have to take it one step at a time. And that's frankly why I think our approach to trying to manage the gatherings more carefully and gradually works better than allowing folks to come back. It's just the crowd mentality is not conducive to these kinds of measures. And so I was really pleased with what I saw yesterday, and know that it's going to be, and I was on the call with the mayors this morning, and they said it's not going to get any easier, it's going to get harder as more people come out.
And when you were deciding to reopen parts of the economy, how much did you weigh the economic toll that specifically the beaches and small businesses were having because of this?
Weighed it heavily because it is a balancing act, and it's not a question, as I've said, either or. You have to have both. You can't savage and ravage the economy and expect that you're going to be able to heal things, you know. We've got serious mental and emotional, negative mental and emotional health effects of the quarantines. I've mentioned it before with respect to people I come in contact in my own family, with my mother, and the isolation that she's experienced. And yet we know that controlling, public health professionals tell us, we know that the way to control the virus itself is by, isolation, keeping people separate one from the other. Now we've got to imagine it in a different way. Instead of isolating the community, we're isolating the individuals that are COVID-19 positive. Never done that before. No state has. And so that'll be the test. How effectively can we do it that way? Because that's the way we're going to manage it from here on out. We're not we're still at phase one, and so we still have some sector limitations in terms of circulation and gatherings, but we're going to quickly move to, I was looking at traffic counts, and even with the lifting of some of the beach restrictions, traffic counts on Route 1 and 24, right kind of in the heart of the beach area, was down by like 40%. Now, again, bad weather and whatnot, but that makes a difference. So we're moving beyond that and moving into so to your question, it's just going to be more challenging.
And how would you respond to residents who think that you're just giving in to the demands of the business community?
Yeah, that's I feel like I've been a referee of some sort, and it's not just me. We're all kind of thinking through this and trying to balancing out those really those two very important imperatives, the economic one and the public health one. And you can't have one without the other, and you have to find a way to balance the two. We're not ignoring public health. In fact, we're saying, you know, all the indicators, and the hospitalization rate, I keep going back to that. Think about it, you know, in the county where the rates have been increasing the most, where we've done the most testing, the most people arguably vulnerable to exposure, the hospitalization rates aren't there. In fact, they're going down, meaning that the disease is not as severe for those folks for whatever reason. And so that gives you a level of comfort that you can start to move to open up parts of the economy and not risk the health and welfare of folks in the communities.
And with the state expanding testing, how will you all delineate between just increased testing in terms of positive cases or an outbreak as a result of these lifts?
I'll let Dr. Rattay address that. I think it's a function of infection rates, but we've had, AJ mentioned one of the test sites, I think it was Middletown, where we tested almost 1,000 people, and then they were symptomatic and asymptomatic, and it was like 2.8% infection rate. When we first started testing the poultry workers, it was, you know, closing in on 30%. So, and we're going to have those, I think. Dr. Rattay, the question is, how do you identify that and get ahead of it?
Yeah, I mean, and this is why it is so important to keep an eye on multiple indicators, because there is no one indicator that is going to tell us everything we need to know. The COVID-like illness graph that the governor showed is an early indicator. Hospitalizations are not so much an early indicator, but they are a really good indicator of acuity in the community, and they're not related to testing. But it is an important point.
Do you all expect to see a slight bump in hospitalizations or daily increases just as a result of these bans being lifted? Is that something that is projected in the data?
That's what the public health people suggest. But I'm praying for it to not happen.
I believe, Meredith, if Delawareans are able to wear face coverings and keep themselves distanced from one another no matter where they are, I think that we can keep this under wraps. But I think a lot of it has to do with us.
How confident does DPH feel the accuracy of the virus-related death statistics are? That's from the Delaware Public Media.
So we feel confident about the accuracy of our death data. The deaths that are reported to us are a reflection of positive cases, positive by PCR. Now, I will tell you, early on, when we had a shortage of testing, there were less than a handful of deaths that were considered probable because we knew, based on their exposure in a long-term care facility, that they were, and their symptoms, that they were positive. But other than that, all of our death cases have been individuals who've had a positive PCR result.
From Susan Canfora at Coastal Point newspaper, will the governor please comment on the lawsuit concerning what religious restrictions you've lifted in response to Dr. Bullock filing a federal lawsuit?
Well, it's probably not appropriate for me to comment on a litigation or a lawsuit that is active. But what I can say is that all along we've approached religious practices and worship in a way I think that's consistent with its importance as a right for Americans and Delawareans. We never officially closed them down. They were always designated as an essential service, and tried to apply public health principles to protect the worshipers. And I did consult with religious leaders. As I've mentioned in the past, I have a council on faith-based partnerships that have representatives of Christian faith, Muslim faith, Jewish, you name it. And they were all very strongly for keeping protections so that first and foremost for them it was keeping their congregants, their worshipers safe. Our limitations had nothing to do with a religious practice or not. It had to do with the principles of protecting public health and safety. And so that's what guided us. And, I had religious leaders saying, you should reduce the restrictions, and I had others that said you should leave them on now, in particular because a large proportion of our congregation are vulnerable populations over age 65. And so we took all those factors into account to try to recognize how important religious worship is in people's lives. I've talked about my mother who goes to Mass every day, and it's the most important part of her life, and it's been gone now for a couple months, and she's eager to get back in church, and she's still in one of those vulnerable populations as she's healthy, but she's 89, and she probably should wait longer. I'm not going to discuss publicly the conversations she and I have about that, but I know she's eager to get back.
A few questions about different aspects of the changing restrictions as they're being reduced. First is from Sean Green at WDEL, who asks, is the state looking into the charter boat industry and whether cruises of less than 10 people could be permitted?
Yeah, it is one that we've been looking into, and I don't know whether Dr. Rattay or AJ knows the status, but it's kind of a unique business sector, if you will. AJ, do you know any more about that?
No, so we did, I'm sure people saw the outcry from the charter industry this weekend, and, we kind of made sure that we reached out to them. We had conversations yesterday with one of the captains a few times to talk about what we can do with public health guidance to help them open up sooner rather than later. So I believe between the Department of Justice, Division of Public Health, there should be, in small business, there should be some guidance, hopefully, if not today, tomorrow, that should help them get back to business sooner rather than later.
Governor, the next question's from Sophia Schmidt at the Delaware Public Media. In reference to your change effective June 1 of public gatherings up to 250 people, does that include community pools as well? I know some other guidance had been put out earlier in the week about that.
Yeah, that's a good question. I don't know. I know Dr. Rattay's been part of those discussions.
Yeah, in regards to pools, because it's they're enclosed settings. At this point, there's separate guidance on pools, which is related to kind of the overall square footage of the space inside the enclosed setting. So the new guidance around gatherings is really in regards to settings where there is no enclosure, where people aren't in a fenced-in area.
Melissa Steele at the Cape Gazette asked, could someone clarify the restrictions for movie theaters?
We'll let Dr. Rattay take that one.
So under the Phase 1 guidance, movie theaters would fit under performing arts. And so for performing arts, 30% capacity, 30% fire capacity is what is allowed during the Phase 1 reopening plan.
So the only thing to add to that too that I know we talked to Jamie about is, even though those auditoriums like this seem big. The choke point is the ingress and egress, where people are then, very close to each other. So that's the concern. That's, I believe, what led to the capacity being lower than probably what was expected or requested.
Our final question is, has the state issued any citations for out-of-state quarantine violations? And Governor, do you have a message for the Delawareans who may have been caught in a delay on Route 1 Friday afternoon with some of the increased enforcement that was going on? It's from WDEL Sean Green.
Yeah, I don't know the answer to the question about whether and how many citations have been issued. My guess would be some have, but not a lot. That's something that can be referred to Delaware State Police, the Attorney General's office, or local police officers. With respect to the checkpoint on Route 1 on Friday, I want to apologize for that. It didn't work out the way that it was expected. We had hoped to have patrols that just made it clear that to out-of-state drivers that of their obligation for 14-day quarantine. It wasn't meant to be the inconvenience that it became, and I apologize to anybody who was inconvenienced by that. So again, thank to the media for coming. Thank you for helping us get the word out through the last 3 months as the state has responded to the COVID-19 pandemic here in our state. Again, our thoughts and prayers go out to those Delawareans and their families who have died as a result of COVID-19. At the same time, we thank and express our gratitude to everyone who sacrificed over the last 3 months. We know the toll has been great for many, particularly small businesses in business areas that involve gatherings like restaurants, tourism, and many others. We understand how difficult it's been for folks to stay at home and the stress that creates, and we want to thank everybody for leaning into that, for wearing face masks in public, for looking after your neighbor. We still have a ways to go. We're moving into another phase as we approach phase 1 and start to returning the lights back on in our economy in a gradual way, moving that dimmer switch up to a brighter level and hopefully to a brighter future for our state. So thank you very much, and we'll see you later in the week.